Good morning, all of you. In last lecture, I had started the microbiological assay. In today's lecture, we will continue the same point, that is microbiological assay, the preparation of standard solution. To prepare a stock to prepare a stock solution, dissolve a quantity of standard preparation of a given antibiotic. To prepare standard solution, dissolve a quantity of standard preparation of given antibiotic, accurately weigh and previously dried whether it is where, so it is indicated in above discussion or above table. Then the solvent specified and then dilute to the required concentration as it is mentioned, and store in refrigerator and use within the period indicated. Here we can see the name of antibiotic, then method of assay, then and different concentration of solution, and the incubation temperature. Here we can see the different thing, that is name of antibiotic, then method of assay, that is assay method, then prior drying whether it is as or no, then initial concentrations of solvent, then final stocks of concentration, then final diluent, then dose and incubation temperature. Next, the preparation of test microorganism. Here we can see the name of antibiotic and the name of test organism. The test organism for each antibiotic together with identification number in the American type culture collection, that is capital ATCC, American type culture collection, and the national collection of type culture, that is capital NCTC, or the national collection of industrial bacteria, that is NCIB. Here we can see the name of antibiotic and the name of organism. First, amikacin for this test organism, that is Staphylococcus aureus. Then for amphotericin B, Saccharomyces cerevisiae. Then bacitracin, then Micrococcus luteus, then bleomycin, Mycobacterium smegamtis, then carbenicillin, Pseudomonas aeruginosa, and deoxycycline, Staphylococcus aureus. These are the name of antibiotic and the name of test organism. We will see the assay method first, that is cylindrical plate method, or this method is also called as cup plate method. In this method, inoculate a previously liquefied medium. In this method, inoculate a previously liquefied medium appropriate to the assay with a requisite quantity of suspension of the microorganism. Add the suspension to the medium at a temperature between 40 and 50 degrees Celsius, and can immediately pour the inoculated medium into petri dishes or the large rectangular plate to give a depth of 3 to 4 mm. Then next, ensure that the layer of medium are uniform. To ensure that the layer of medium is uniform in thickness by placing the dishes or the plates on a level surface. It means to ensure that the layer of medium it is uniform in thickness. It means to check the thickness, then by placing the dishes or plates on a level surface. Then using the appropriate buffer solution, prepare a solution of known concentration of the antibiotic to be examined. Then apply the solution to the surface of solid medium. In a sterile cylinder or a cavity is prepared in the agar. The volume of the solution added to each cylinder or each cavity, it should be uniform and sufficient almost to fill the holes when these are used. Then Leave the dishes or the plates standing for 1 to 4 hours at a room temperature or at a 4 as appropriate as the period of pre-incubation diffusion to minimize the or in order to minimize the effect of variation in time between the application of the different solutions. Then incubate them for 18 hours at particular temperature. Then accurately measure the diameter or the area of circular inhibition or the zone of inhibition and calculate the result. Here you can see the formula. L is equal to 3a plus 2b plus c minus e divided by 5, and H is equal to 3e plus 2d plus c minus a divided by 5, where L is the calculated zone diameter of the lowest concentration of the standard curve response line. Then H is the calculated zone diameter for the highest concentration of the standard curve response line. Then C is the average zone diameter of 36 readings of the reference point standard solution. Then and where A, B, D, E is the corrected average values. A, B, D, E are the corrected average values for the other standard solution, lowest to highest concentration respectively. Then here we can see the different areas, then growth, antimicrobial disc. Then here we can see the zone of inhibition and plot the graph, log concentration of antibiotic versus the zone of inhibition. Yes, plot the graph for what? That is the log concentration of antibiotic versus zone of inhibition in mm. Then so this is the cylinder plate method or the cup plate method. Next, that is turbidimetric method or the tube assay method. In this method or the method has advantages of shorter incubation period. Keep in mind, see here what I am saying. I am repeating here. This method having the advantage. So what is the advantage of this method? The shorter incubation period for the growth of the test microorganism, usually 3 to 4 hours. But the presence of solvent residue of the other inhibited substances, it affect the assay more than the cylinder plate assay. Then in this method, first prepare 5 different concentration of standard solution. For preparing the standard curve, by diluting the stock solution of the standard preparation of the antibiotic and increasing the stepwise ratio, that is 4:5. Then select the media concentration and dilute the solution of the substance being examined, that is unknown, and to obtain the approximately this concentration. Then place 1 ml of each concentration of standard solution and कोण आहे माझ्याकडे काम आहे. Then place the 1 ml of each concentration of standard solution and the sample solution in each of the test tube in duplicate. To each tube add 9 ml of nutrient medium previously seeded with a appropriate test organism. Then at the same time prepare 3 control tubes. One containing the inoculated culture medium, that is culture control, another identical with it but treated immediately with 0.5 ml of dilute formaldehyde solution, that is blank, and third containing uninoculated culture medium. I am repeating here. At the same time, prepare 3 control tubes, one containing the inoculated culture medium that is culture control, then another identical with it but treated with immediately with 0.5 ml of dilute formaldehyde solution that is blank, and third containing the uninoculated culture medium. Then place all the tubes randomly. Then place all the tubes randomly distributed or in a randomized block arrangement in an incubator or the water bath in order to maintain at the specified temperature, that is for 3 to 4 hours. And after the incubation or after the complete incubation, add 0.5 ml of dilute formaldehyde solution. Add 0.5 ml of dilute formaldehyde solution to each tube. Then measures the growth of the test organism by determining the absorbance at 530 nanometer of each solution in the tubes against the blank. Then formula for calculation: L is equal to 3a plus 2b plus c minus c divided by 5, that is H is equal to 3e plus 2d plus c minus a divided by 5. Then where L is the calculated zone diameter for lowest concentration of the standard curve response line. I am repeating, where L is the calculated zone diameter for the lowest concentration of the standard curve response line, then H is the calculated zone diameter for the highest concentration of the standard curve response line. C is the average zone diameter of 36 reading of the reference point standard solution, and whether A, B, D are the corrected average values for the other standard solution, lowest to highest concentration respectively. Here we can see the drug concentration in tube and the amount of growth. Then these are the two methods that are used for assay. Then the minimum inhibitory concentration, that is capital MIC. The minimum inhibitory concentration is the lowest concentration of an antimicrobial. The minimum inhibitory concentration is the lowest concentration of antimicrobial that will inhibit the visible growth of microorganism following the overnight incubation, usually reported as a milligram per liter. Then a related concept is the minimum bactericidal concentration, that is MBCS, minimum bacterial concentration, which is the lowest concentration of antimicrobial that will prevent the growth of organism after subculture onto antibiotic free media. Then infections in the ICU are often caused by pathogens with a higher MICS, that is minimum inhibitory concentrations, with other clinical setting. Then regular surveillance of minimum inhibitory concentration is required due to the continuing decrease in the susceptibility to the commonly used antibiotic in critically ill patient. Then what are the importance of this minimum inhibitory concentration? Define the drug exposure necessary to ensure the patient achieves a predefined PK or PD target that associated with maximal efficacy. Then research tool to determine the in vivo activity of new antimicrobials and determine the MIC breakpoint. Then third, monitor resistance to antimicrobial agents. Then the methods of determination by agar method or the both dilution methods. Then strip with graded changes in antibiotic concentration provided. Then when placed on a plate, the point at which the bacterial inhibition intersects with a strip in the MIC, that is minimum inhibitory concentration. Then what are the clinical applications? First, generally drug concentration need to be 4 to 5 times MIC to ensure that antibiotic is effective. I am repeating here. Generally, the concentration need to be 4 to 5 times that MIC to ensure that the antibiotic is effective. Then the different antibiotics depend upon Cmax, AOC, the MIC, and time above MIC for a maximal effect. Then most laboratories routinely report susceptibility with the classification that is SIR. Yes means susceptible. I it means intermediate susceptible, and R is the resistant based on the minimum, that is based on the MIC breakpoint. Then the breakpoint is the chosen concentration of antibiotic which defines the breakpoint is the chosen concentration of antibiotic which defines whether the species of bacteria is susceptible or resistant to the antibiotic. Then the MIC is less than or equal to the susceptibility breakpoint. The bacteria is considered susceptible to the antibiotic. Then what are the advantages of this? It is easy to perform, familiar and widely used, then usually automated, then highly reproducible due to the simplicity and the automation, then rapidly produce rapid result. Then what are the disadvantages? MIC can vary greatly with a minor variation in methodology, can result in large variation of MIC. Then for example prolonged incubation may increase the apparent MIC. Then example, smaller inoculum concentration may decrease the apparent MIC. Then the comparison between laboratories are hindered by differences in technique used. Then inhibition of visible growth does not mean the organism were killed. It means minimum bacterial concentration. Then MIC is not truly a single number, but a range is depend upon the dilution series used during its determination. Then MIC does not necessarily equate with in vivo efficacy. For example, an antibiotic will be effective if it does not penetrate the affected tissues. Then antibiotics with higher MICs may still be effective if the concentrated at the site of infection. An antibiotic will be ineffective if it does not penetrate the affected tissues. Then antibiotic with high MIC may still be effective if concentrated at the site of infection. For example, treatment of UTI with gentamicin, which concentrates in the urine. Then antibiotic kill characteristics are important. For example, concentration versus time dependent killing. Then critically ill patients may have altered pharmacodynamics as well as pharmacokinetics. Then breakpoints are often subjective and may not correlate with clinical outcomes. Next, we will see the assay of vitamin or the microbiological assay of vitamin. The microbiological assay of vitamin is the type of biological assay performed with aid of microorganism. Then many therapeutic agents which either inhibit the growth of microorganism or are essential for the growth of them are standardized by microbiological assay or the microbial assay. And the principle of microbial assay were developed in the year 1920s. Then we will see the principle. Vitamin and amino acids are essential for growth of microorganism. The vitamins and amino acids are essential for growth of microorganism. Then the basis of this assay is to measure the ability of test organism to utilize the substance being assayed under a proper nutritional condition. Then the organisms require this growth factor, vitamins and amino acid in a micro or the nanogram, in a microgram grams or the nanograms. Then the response, that is the growth of test organism, is proportional to the dose, that is amount of factor added to the medium. Then, so what are the materials or the material required for the microbial assay of vitamins and amino acid? That is first a stock solution, then then inoculum media, then assay medium and a standard curve. These are the four material required for the microbial assay of vitamins and amino acid. What are those requirement or what are those material? First, that is stock solution, then inoculum media, then assay medium and standard curve. Next point we will see in next lecture.